A major cardiac health event can be devastating to the person who lived through it, but that doesn't mean life has to stop with lingering complications. Providers at Arnot Health's Heart and Vascular Institute use a team approach to
help the patient to get into the speedy recovery and also down the road better outcomes.
And cardiac rehabilitation is helpful for
any patient who had a heart attack, who had angioplasty, stent placement, bypass surgery, any valve replacement. And now the latest one is even heart failure patients.
Before someone can be referred to the program, providers need to make sure their body can safely handle exercise and movement again.
In some patients who are unstable, that means who are having ongoing chest pain, who are in active heart failure, those patients need to be stabilized before going into the program.
Once stable, the journey to recovery can begin. Patients are eased into the program. Specialists break the plan of care down into 4 separate parts.
The first stage will be started even during when they're in the hospital. And the rest 2, 3, 4 will be done as an outpatient. 2, 3, most of the time under supervised condition. 4 is unsupervised. They'll be continuing whatever they learned in the rehabilitation program.
Anyone can fit in and exercise at home, but rehabilitation focuses on more than someone's ability to complete a workout without risking their health.
Imagine if somebody, your family member, had a heart attack. They'll be so anxious, even a little bit of here, a little bit of there. They'll be thinking, is it another heart attack, or am I having any issues with the heart?
Exercise naturally increases your heart rate. Dr. Akula says it's not uncommon for patients to hold a hand over their heart during different exercises.
Need to be reassured, stressed upon, and during exercise when you do that, that'll give them the positive reinforcement and very kind of reassuring.
The team helps patients regain physical strength while working on mental blocks, helping overcome fear.
Psychological benefit. All these symptoms of anxiety and depression will be addressed during those at the input and also throughout the session. And also they'll be monitored in terms of how better the blood pressure is controlled, and the exercise training, and then weight loss training and dietary management.
More information about cardiac rehab services can be found at arnothealth.org/directory/offices/Heart Vascular Institute. For Arnot Health, I'm Lexi Cutmore.